of this scale anywhere else. For what it's worth, already the number of delegates is 2 times every other place, right? So I think there is a lot of excitement in our city, in our state, and in the region of the South to make things happen. What is more interesting is if you look at the VCs that are coming. So far we've had about 40 VCs and angels who've confirmed. And this is ranging from Indian Angel Network, that clearly doesn't sit that much in Chennai, sits more in Delhi. We've had Let's Venture, we've had Axel. So Axel's the investor in Flipkart and many of the other success stories. They're sending 3 people to evaluate the session. Therefore, they really believe you can find gems in the sand of what we will find. And the reason for that is simple. It's the first time you've got technology providers, healthcare providers, and the other people in the ecosystem coming together, the accelerators, the incubators. What we haven't spoken so much about is this is the first time that IIT Madras, IIT Bombay, IIT Delhi have all come together, right? VIT. So we're working with not only our universities locally, we're working with universities across the country to make sure that healthcare actually sees a lot more innovation happening. So we didn't stop at just universities. We went far and wide. We looked at the angel and VC groups. So we have guys like Let's Venture, TIE, Chennai Angels. We went beyond that into technology. So we got NASSCOM. We wanted other organizations to come together. So ASOCHEM, FICCI. These are organizations that will run their own event. Why are they focused on us? Because none of them have been able to crack this code. Healthcare has been one of those domains where if you can bring customers together, if you can bring clinicians together, and if you can bring people who can make both their lives better so that we can actually get more done, right? Because India is not the same problem as the US. Everyone's heard that. But really, what does that mean? That means that we have to do it at a cost. So if you're asking me, it's great to hear King's College is coming to Chennai, right? The reality is, let them come to Chennai and let's see what price they offer it at. We've seen enough foreign participants come to India and struggle. We've seen Indian participants come to India and struggle. It's not new. We've seen government roll out big schemes that we're still trying to figure out how funding comes for many of these big programs. And our hope is by us focusing on reducing the cost, on increasing the standards, we will help some of these groups solve the problem. Our hope is, and the government is a partner for us, so they're actually sponsoring most of the startups. What we haven't spoken about is the government is actually sponsoring most of the startups to come, right? Because they want this technology that gets trialed, that works in a small private hospital as a pilot, that can then maybe go to a bigger government setup scheme, whether it's Ayushman Bharat or the existing big government hospitals. That's the hope, right? I think what people haven't understood perhaps so far is we are very diverse groups in India. People say that organized healthcare, India has got great healthcare. But in the world of organized healthcare, we're a fraction. The biggest group represents what? Less than 5 to 10% of total health. And that is probably, to be honest, the mission hospitals or the army. It's one of those 2 groups that represents the biggest single targeted population. It's not an Apollo or Fortis or Narayana, it's not a Vijaya, Mehta or a Sitapati, it's not or a Meenakshi, it's not us. So how do you get different people who have the best practices? The best practices of Meenakshi in imaging, the best practices of Vijaya in terms of IoT, maybe the best practice in Sitapati that can try something in AI, the best practice at Mehta that does something around efficiency. Can you bring these practices together in a group with a champion, right? Because if you don't have champions, nothing happens. And if you can implement that, then we can actually make a difference to Ayushman Bharat or India. Because at the moment, I can do something in my hospital. The ability to make that relevant for every group is what Caho Tech is about. If you look at the number of partners, this is the first time I've ever seen a conference, and you can ask him how many partners they've got. Over 25. And these are not small groups. They range from the government, they range from big organizations like ASOCHEM and FICCI, to NASSCOM, to organizations like the Manufacturing Association of India, the Electronics Association, CHIME, which is the IT CIO Association. And if you're wondering what have they got involved in this for, the reality is everyone wants something to happen. It's like a jigsaw puzzle. If you don't put all the pieces together, you don't get perfect health. So we're trying to do good health for the healthcare industry. For that, technology is important. For that, clinicians are fundamentally important. And for that, I think bringing people together is what we needed. We're lucky. Chennai is going out of the ballpark. Last year's event had 400 to 500 people. This year, 1,000 people. IIT is inaugurating their brand new auditorium on the 7th floor of their research park. Right? We are the first user. And the joke is that we have finally got IIT to deliver something well ahead of schedule because all the industry came together. IIT is a partner. We wanted them to be a partner knee deep. So half of the professors who are coming with content, the haptics lab, the AI lab. Professor Ravindran is the head of the AI lab. We've got Professor Mohan Shankar who's coming and talking about HTIC. We've got Professor Poini coming in from IIT Bombay talking about what they're doing specifically around the sensors that they're helping test. Right? And what we thought is we put these different pieces together, you will actually get something much bigger than what I will see, what Madam will see, what Adil will see in different parts of the country or different parts of India. If you can put them together, there is a chance that India's dream of healthcare for all will happen at a cost that we can afford, because today we can't afford health. Right?
Healthcare, sir. Do you have any specific focus on any particular segment?
There are 4 in the conference. Right? So we have AI, machine learning is one session. That's why Professor Ravindran is coming. We've got clearly, I think, the lab on a chip, or what we call the point of care diagnostics, right? And the reason that's important is you need to get that at a low enough cost and a good enough. The problem with point of care is I can do things in a big machine where I can get lots of tests to it, which is what most of your lab chains and diagnostic centers today do. But my cost, when I do only 2 or 3 tests in a local environment, is very hard to compensate. It will cost me maybe 100 rupees to do that test when I do 100 tests. But when I, like what Thyrocare has been able to do or Lister has been able to do over the years. But when I do that at a specific point of care, let's say in a government clinic or in a community clinic or in one of our outreach centers, how can I do that for 100 rupees, or when I'm going to charge the patient 1,000 rupees, then they can't afford it. So that's a big piece, and for that we're flying in our Professor Lee from Korea, right? And she has got the knowledge and the implementation of that. We're mixing that with the Indian guys because we want something that works here. So that's the second one. The third is around sensors and manufacturing. So for sensors and IoT, we needed, so the specialist there is Josh Folger. They're doing stuff for Apple. I think most of you will hear the good news soon. Xiaomi, they're the ones who manufacture all the Xiaomi products and watches globally. So some of those guys, so Josh Folger is the country head of Foxconn coming in to specifically talk about that. Then we've got the fourth piece of the puzzle was AI sensors. What am I missing? I always forget the fourth.
Digital.
Digital health, right? The piece that adds it all together, the software. And for that we got enough companies. We got our, what's his name, Lakshmi of Cognizant. We got Somithil, the founder of NASCOM, flying in, right? Think about it. The founder of NASCOM is coming. The former head of NASCOM is coming, Lakshmi. We've got Arun Jain of Polaris coming. Why are they coming, right? All these people are busy. Healthcare is 3 degrees away because they all need healthcare at some point in their life. And they're realizing that if they don't implement it, we will never see a better world and we will never see a better India. So these are the 4 focus areas, right? There are very clear tracks for these. So therefore, if you're interested in just some part of that, you'll see it, but we want people to add the dots between them. Because you can't have an IoT device without, for example, having the manufacturing capability for that, without having the software or the digital health interface, without that also tying up with, say, some customer portal that gives the data on a mobile phone to you and me, right? Maybe in a vernacular language that's relevant for the customer, with the help. That piece we still need integration on. That's why we've got these components.
We have also, these are not, please understand, these are not just technologies on paper. These are implementable technologies. இதெல்லாம் இன்னைக்கு ஹாஸ்பிட்டல்ஸ்ல நடந்துகிட்டு இருக்க விஷயம். நமக்கெல்லாம் தெரிய மாட்டேங்குது, அதுதான் இஷ்யூ. இப்போ அரவிந்த் ஹாஸ்பிட்டல் கூகுளோட சேர்ந்து they have done something in AI, ஆர்டிஃபிஷியல் இன்டெலிஜென்ஸ் பண்ணியிருக்காங்க. நிறைய பேர் தெரியாது. ஹாஸ்பிட்டல் நடக்கிற நல்ல டெக்னாலஜி இம்ப்ளிமெண்டேஷன்ஸ் அதை எடுத்து காமிக்கிற ஷோகேஸ் பண்ணக்கூடிய விஷயங்கள் தான் இன்னைக்கு நம்ம பேசிக்கிட்டு இருக்கோம். நம்ம பேசுகிற ஹாஸ்பிட்டல் தான் பார்த்தீங்கன்னா மெதாந்தா ஹாஸ்பிட்டல், கொலம்போ ஏஷியா ஹாஸ்பிட்டல், அம்ரிதா ஹாஸ்பிட்டல், கொச்சி, like Aravind Hospital. All of these hospitals have been implementing these technologies somewhere or other. This conference, this event is going to bring them all, the research people and the implementers like hospitals will come together and showcase these and talk about these ideas. That is all the event is about.
And to add to your question, இப்போ பேஷண்ட்டுக்கு என்ன பெனிஃபிட்னா the use of technology must bring down cost first. Second,